Informed consent in a patient's shoes. Uninformed consent goes something like this.
Okay then, Mr. Miller, we've had your blood test back, your white cells and CRP are up, so we do think it's appendicitis. What we can do for you today is take you for a keyhole operation to take your appendix out and get you better again, okay? It's a fairly low risk operation, just a few cuts in the tummy. There's some risks of pain, of bleeding and infection, and there's a risk that we might need to make that a bigger operation, okay, and cut open your tummy. I've signed here. You could just sign here for your operation today. Okay, and we'll get you up to theatres and get that done today. We'll see you in theatres.
Who is she? What's CRP? What is an appendix? What is keyhole surgery? What have I let myself in for?
Valid patient consent requires information and understanding. Not all patients feel empowered enough to ask doctors questions or to let us know when they don't understand.
Hello again, Mr. Miller. I'm Ellen Jerome. I'm one of the surgeons working for Mr. Philpott, the consultant on call today.
Hello, doctor.
Hello. We've had the results from your blood test back. Some of the markers of infection are raised, which supports the diagnosis of appendicitis. And what we'd probably recommend for that is a laparoscopic appendicectomy. Do you know anything about the appendix or appendicitis?
Not a lot.
Okay, I'll tell you a bit about it now. Do you mind if I just sit here?
Please do,
Thank
yeah.
you. All right. So imagine this is your body. Okay, there are your legs and your belly button's there.
Just a few minutes of explaining to the patient what's happening can make all the difference.
Okay then, Mr. Miller, so just to summarise, we've talked about appendicitis and why we recommend removing the appendix to treat it. We've talked about what your recovery is likely to be and a bit about how we do the operation. Do you have any other questions at the moment?
No, doctor, I feel very well informed. Thank you very much.
I've written out a consent form here, so if you just happen to sign on the line. And we'll see you a bit later for the operation.
Thank you.
These simple steps can improve our patient's understanding. Introduce yourself. Assess prior knowledge and give information accordingly. Use visual aids. Avoid medical jargon. Summarise. Offer the opportunity to ask questions. And with patient understanding comes patient empowerment and trust.